everybody. Hope you're all doing fine and you're all moving on by God's grace. Thank you so much. I can't stop appreciating those who are watching my videos. I can't stop appreciating those who have subscribed, those who have liked. Thank you so much. May God bless you. Mwah. Those who haven't subscribed, please subscribe to my channel, watch my videos, and like and share and comment. Thank you so much for those who are watching my videos. You encourage me, you keep me move forward. Today I want us to discuss on something little, and I want us to discuss on the tips to be prepared when you're going for delivery. And for me, I have some few tips that I want to share with you. And the tips I want to share with you is, first of all, what kind of birth am I going to give? Is it a vaginal birth, or I'm going to give through cesarean section? I have 4 days to my appointment, and the news that I have for you is I'm giving my birth through cesarean section, and this is due to my first baby was through cesarean section because I had complication with my first baby, so I had to go under cesarean section. The second baby, the same, I went through cesarean section. So this is the third one, and this one also my doctor said that I should go for cesarean section. So because of the previous scars, also this one I have to go for cesarean section. But what preparatories do I have before going for, because I've said that I have almost 4 to 5 days actually before going for my appointment, because I'm already 38 weeks, 37 and some few days. So I have some few days to get to 38 weeks, and my doctor said that when I clock 38 weeks, I should go for the operation. So today I want us to discuss on some tips. Personally, I want to discuss on what I was told before going for cesarean section. So I would like to share with you also, if you're going for cesarean section, what tips should you prepare before going for your appointment? First of all is your documentation file. Like for me here, this is my file from my doctor, and just so many documents, because all from my first baby, the second baby, the third baby, and this is the third baby actually. So all the documentations are here. So please make sure that you have your file where you put all your documentations, so that when you go to the hospital, you are ready with your documentations, because these ones are very important. Okay, the other tip that I'll also want to share with you, according to my personal experience with the first baby and the second baby, what the doctor told me, the first 8 hours before going to the hospital, or before the going to theater room, I shouldn't have eaten anything or drunk anything. The rules may have changed. Some scientists say maybe nowadays people can eat something or they can drink something, but for me, according to my doctor, what my doctor told me, I should not eat or drink anything for the first 8 hours. So my appointment, when I'm going for my appointment, I leave my home when I've not eaten anything or drunk anything. And this, what my doctor explained to me, is because it can bring complications to the lung, it can bring likelihoods of vomiting and things like that. So for me, I was told that not to drink or to eat anything. It's a little bit weird, but I did it with my first baby, I did it with my second baby, and also this one is my third baby. My appointment, I'll also do the same. So if you're preparing to go for cesarean section, first of all, have a discussion with your doctor. What and what not to do. So for me, I'm sharing what I was told not to do before going for my cesarean section. The other thing that I was told also to do, as women, we like being clean. So you find that you shave your stomach, you shave your pubic area, you shave everything so that you can be very clean. This is very nice, but my doctor advised me not to. And what my doctor told me is, because when I shave, maybe I can use a razor blade or something that will bring some small pimples or small wounds that will cause infection during the period of cesarean section. So I was told not to shave. If I can shave, then I can shave maybe a week earlier, or before that, but not on that day that I'm going for an appointment, then I start shaving and become so clean and things, maybe waxing. Sometimes you can do waxing and everything, but for me, I was told not to. Even waxing, my doctor told me not to do that. I can shave maybe a week earlier, I can wax a week earlier, but not on that day that I'm going for my appointment. Then I wax or I shave. It's not advisable for my doctor. That's what my doctor told me. The other thing is pain management. You also have to discuss with your doctor pain management. How are you going to handle that pain after the cesarean section? Because after, it's going to be very painful. Like for my second baby, my first baby, it was very, but what I did, discussion before, it's very important. Discuss with your doctor how it's going to be. Like for me, I was given medicine. Some medicine was how do they put it, epidural or something, but some was given through the mouth, but some was given through injections. All those were pain management. So you make sure that at least after and before you are given medicine for your pain management, because afterwards you'll have to breastfeed your baby, you'll have to take care of your baby. So pain management is also something very nice you can discuss with your doctor. The other thing is how your incision should be. So you also discuss with your doctor. There are some that they prefer staples, some prefer stitches, some prefer glue. It depends on how you prefer with your doctor. So you also discuss that with your doctor. How are you going to do the incision thing after giving birth? So for me, because the first one I had the staples, the second one I had stitches, and also this one my doctor said that I'll have stitches. So at least I've already known, not that after removing the bandage afterwards, then you'll become shocked. But for me, I've already discussed with my doctor, I'll have stitches, and then stitches will be removed after some time. So you also discuss with your doctor how the incision is going to be. The other thing that I will also want to share with you, what I was told, also on that day before going to the hospital, I should clean myself with a medication soap. I think my doctor said medication soap, something, a special soap kind of, so that at least I use it to shower to clear up the germs and the bacteria is in my body. So even my clothes, like for me, my previous baby, I even boiled my clothes and soaked them with medication soap. So you can also do the same, so that you can be very clean and you can protect yourself from any infection. Because you know, cesarean section it includes cutting your body and everything. So any little infection can really affect the process. So please, for me, I use medication soap. Any soap that will be advised by your doctor, any soap that is sold in pharmacies, but your doctor will advise you on which kind of soap to use, so that you can have your shower on that day, so that when you go, you become very clean. And also the clothes you're going to wear before wearing the hospital gown, at least that one should be very clean, and you should also be very clean. So those are some of the tips that I was told by my doctors before going for the cesarean section. And also the other thing is to prepare myself mentally, and that's why planning ahead is very important. Not just waiting until it's time was bumped and then you are panicking. Planning ahead is very important. Preparing yourself mentally, preparing yourself emotionally, and everything, and even praying. For me, I'm Christian, so praying is my first priority thing, because you never know. These things are done by doctors who are human, but praying and putting God first is very important. So those are some of my preparations before going for my appointment. So my appointment is to 45 days. I'm going to see my doctor so that I can have my little angel out of me. Otherwise, those are some of the few tips I would like to share. Those are my personal experience. Those are my personal tips that I was told by my doctor. So you can have your doctor can advise you. Otherwise, your doctor can advise you the other thing, or the other way around. It depends on how your doctor will advise you. But please have appointment with your doctor so that you can have this thing planned prior going for your appointment. So thank you so much for watching. I hope these tips have helped you. First time mothers who are planning to go for birth, please plan ahead and do it in the right way. Otherwise, pray for me and wish me well. Thank you so much, and bye for now.